So welcome everybody. My name's Winnie Armand and I'm one of the Associate Directors at the Mass General Center for the Environment and Health. I'm also a physician at Mass General in the Division of General Internal Medicine. And we are so excited to be co-sponsoring this monthly webinar series with the MGH Institute of Health Professions at the Center for Climate Change, Climate Justice and Health for this discussions that we have on the intersection of climate, the environment, and healthcare stewardship. It's really wonderful to have all of our experts on climate change join us and give these amazing lectures. Just a few housekeeping issues. There will be closed caption available for those that want that. And later on today, you will be emailed, or in the next day or two, you'll be emailed the link, thanks to Michael Buznak, who manages to make everything run smoothly on these webinars. The chat is available, but I would hope that you please do enter your questions for the Q&A section, because that's where we'll be following the questions, but the chat is available as well for some of the exercises that will happen later. And at the end of the session, after our speakers have gone, if there's time, with the time that's remaining, we have a special guest, Dr. Elizabeth Pinsky, who is a child psychiatrist at Mass General, who is here to have further conversation and help with the moderation of the questions and answers. So with that, I'm going to turn this over to my accomplished colleague, Patrice Nicholas, to introduce herself and our speakers.
Thank you, Winnie. I'm Patrice Nicholas, Director of the Center for Climate Change, Climate Justice and Health at the MGH Institute of Health Professions, and delighted to also serve as co-director of policy and advocacy for the Center for the Environment and Health. I'm thrilled to introduce our two colleagues, Dr. Sue Ellen Breakey and Dr. Susan Aboukir. Dr. Aboukir is an assistant professor at Harvard Medical School and a senior executive with 20 years experience leading healthcare organizations. She's served as Chief Medical Officer, System Chief Quality Officer, and Chair of the Department of Quality and Patient Safety at Mount Auburn Hospital, where she founded the Department of Quality and Patient Safety and led the award-winning program for a decade. Dr. Aboukir began her career as an electrical engineer in aviation systems. She's a graduate of Harvard Medical School and trained at Brigham and Women's Hospital and continues to practice internal medicine. She also received a master's degree from the Harvard School of Public Health and has taught nationally and internationally on patient safety and other areas of expertise. She co-founded the Harvard Medical School Fellowship in Quality and Patient Safety and has developed several curricula for physicians and healthcare leaders. Dr. Aboukir is a certified forest therapy guide. She offers forest therapy to frontline healthcare workers here where we're located in Boston. She's also developed nature and systems curricula that incorporate forest therapy to support caregiver well-being. I'm also delighted to introduce my colleague, Dr. Sue Ellen Breakey, who's Distinguished Teaching Associate Professor and Associate Director of the MGH Institute's Center for Climate Change, Climate Justice and Health. She completed her PhD at the Cannell School at Boston College. She's also the author of numerous publications in the nursing literature and healthcare literature, and co-authored texts on global health nursing. Welcome, and Sue Ellen will launch our beginning presentation.
Thank you, Patrice. And welcome everybody. Just to set the stage, I think we are probably all in agreement that climate change is one of the greatest public health challenges of the 21st century. It has been noted to be the greatest public health challenge of the 21st century. But given the events of the last 2 years and the converging public health crises, it's difficult to distinguish at this point, where we're headed in that regard. But it's also important to note that the crises of racial injustice, the pandemic, and climate change have really formed together and created a synergy, or a syndemic as it's sometimes called, which really means that the whole is greater than the sum of the parts when it comes to the impacts that each of these crises is having. And this just kind of points out the drivers of the climate drivers, the exposure pathways that we that lead to negative health outcomes. And in addition to that, the environmental, institutional, and social context in which climate change and its impacts are occurring. Next slide, Michael. And this is an infographic from the Centers for Disease Control and Prevention that many of you may have seen, which really just highlights the health-related outcomes and as they relate to the climate impacts. So if you look on the left of this infographic, you see severe weather and environmental degradation as having mental health impacts. And I would add to that extreme heat as well. And we'll talk about that a little in a little bit. Next slide, please. So it is important to note that both individuals and communities differ in their climate vulnerability. And that's based on exposure, sensitivity, and adaptive capacity, and how they respond to climate change. So either within regions, within countries, within states, people have different, there are different levels of vulnerability. So exposure is the contact between a person or a community and one of the stresses that is affected by climate change. Sensitivity refers to the degree to which people or communities are affected. And that can be a positive or a health co-benefit, if you will, as well. We see that with more green space, people, walking instead of riding their cars. That can have positive impacts on health. And then also adaptive capacity, which is the ability of individuals, communities, institutions to really adjust to potential or actual hazards that result from climate change. Next slide. So some of the information that I am sharing today, I've taken from a collaborative review of the literature that was done by the American Psychological Association and Eco America. And so this was published in 2017. It is important to note it was published before the pandemic, but some of the major acute mental health impacts that are related to climate change that appear in the literature include anxiety, which is the most prevalent, trauma and shock, post-traumatic stress disorder, and I include here increased suicidal ideation and suicide, substance use disorder, depression, compounded stress, which is really significant because it is, again, the convergence of several stressors which compound the physiologic and mental impacts. And so this leads to increased substance use, increase in anxiety disorders and depression, which then can lead to lost work days, which may have an economic impact, use of increased medical services, which can be a stressor if people don't have health insurance. And then this compounded, consistent stress leads to decreased immunity, increase in sleep disorders, increased and persistent high cortisol levels, which then further impact someone's physical health for example, with impacts on sleep, digestion, and increased risk for cardiovascular disease. And so this is, these mental health impacts also have the potential to impact physical health as well. And it should be noted that in addition to people developing new mental health conditions related to climate change, the effects really aggravate existing mental health conditions. And so That's also significant and should be noted as well. Next slide, Michael. And this is a bit of a dated slide, but I think still really significant to show the prevalence of mental disorders after Hurricane Katrina. And so this is blue is the baseline, and in yellow is 1 year out. And you can see among the 4 disorders, there was an increase in each instance. And you can see with suicidal ideation, that's about a 50% increase. Next slide, Michael. So these acute mental health impacts then can negatively impact our interpersonal relationships. So within the family, this can result in increased intimate partner violence and child maltreatment. In addition to that, and we saw this with COVID actually as well, but in addition, it should be noted that children are really at risk for mental health impacts, not only because of their individual responses to climate change and the impacts of climate change, but also because they're being cared for by people who then might be stressed and unable to care and nurture their children the same way. Children are also impacted when they have to uproot and move to a different place, maybe a different school. And this can actually really impact them cognitively as well. Social connections can be disrupted. We see this with older adults. Social capital is really important. We know that the more support and social support older people have around them, they do better from a health-related standpoint and from a well-being standpoint as well. And then, you know, I have here climate migrants, whether people are migrating from different countries, regions of the same country. This is a huge impact on someone's sense of belonging and well-being when, again, they're uprooted and they lose those social connections that they had with their community. Next slide, Michael. Some chronic mental health impacts. A huge one is aggression and violence. And there is a causal relationship between heat and aggression. So the more we're seeing high heat days, the more we will see heat-related health impacts, both physical health impacts like heat-related illness, but also the increased need for emergency health services. So this is concerning, to say the least. Next slide, Michael. So there are some emerging chronic impacts in the literature, and 3 that I'm going to talk about briefly include solastalgia, anxiety, and environmental grief. So solastalgia was introduced in the literature by Albrecht, who was an eco-philosopher. And he defined, and it has since been it's becoming more prevalent in the literature. So he defined solastalgia as the pain or sickness caused by the loss or the lack of solace and the sense of isolation connected to the present state of one's home or territory. That is how that is like the actual definition of the word solastalgia. But he also describes it, and I think this is really poignant, as a sense of homesickness when one is still home. And so it's the recognition that the place where you love and you live is under immediate assault. And I think more and more we're seeing this. You know, you turn on the news and you're seeing large areas being ravaged by drought, by wildfires, by hurricanes, and you think about all the people who are impacted personally by that, and who again have to either live within their community and witness that ravaging, or have to like uproot and move to a different place. I just have a note here that Indigenous communities are at increased risk for solastalgia, although we all are, but particularly because of their connection to the land, and the importance of that connection to their sense of belonging and well-being. So there's actually a quote in the publication that I was referring to earlier, and it was a quote from an Inuit member, a community member from like northern Canada, that said, "We are the people of sea ice. If there is no more sea ice, how can we be the people of sea ice?" Which I think is just a very poignant description of that sense of loss that whole communities are feeling. There was a qualitative study that looked at people again in northern Canada who experienced a large wildfire a few years ago in 2016. And they also talked about that sense of loss that they had having to leave their community. Next slide. So ecological grief is defined as the loss of nature and ecological surroundings, which can lead to feelings of anger, frustration, and helplessness. And this is closely tied into eco-anxiety, which is the next slide, Michael, which is described as the distress related to the climate and ecological crises. And associated feelings include worry, fear, grief, despair, guilt, that that as individuals we're contributing to climate change, shame, but also some hope. Next slide. So young people, was there a slide before that? No? Maybe not. Yeah, that slide. This is a slide from a climate protest a few years ago, and these are becoming more of these are happening, but it's really the younger generations who are bearing the brunt and feeling a lot of this eco-anxiety, because they know that they're here for longer than, older generations. And they also feel a sense of disempowerment because they're watching adults and people with authority and ability not really taking the action that they feel is needed. Next slide. So this comes from a study that was actually a lit review done looking at the mental health impacts of climate change on young people in particular. And the research suggests they feel troubled by the state of the world. They worry that the world will end in their lifetime, which is a really profound statement. And as I mentioned, they can experience other feelings of confusion and betrayal and abandonment because of the inaction that they perceive. And this in turn can lead to moral injury. Next slide. So this study, this was published, it's not published, it's part of the Lancet preview documents that they put out. And this was actually just put out, like the survey, the paper was put up on the Lancet site in September, just this past September. So this was an international study of 10,000 young people. They surveyed young people 16 to 24 in four countries in the global south and 6 in the global north. 60% felt very or extremely worried about climate change. And those who were worried were, there were a larger number in the global south than the global north. Greater than 45% indicated that their negative feelings impacted their daily lives, and 77% indicated that the future is frightening. In addition to that, there were 81%, when asked the question, do you talk to climate change with other people? 81% indicated that they did, and of those 81%, nearly half said that they were either dismissed or ignored when they tried to bring up climate change with their peers. Next slide. So this approach was an eco-sociological approach, was proposed by, I think it's just Lassen et al. And they think it's important to highlight the holistic nature of public health. And it's an eco-sociologic approach identifies both social and ecological factors as key components of health and well-being of current and future populations. So I thought this was pretty fitting in terms of what you're going to be hearing about next, which is forest therapy. I thought there was a little bit of maybe a relationship between these two things. And so in addition to social determinants of health, they identified ecological determinants of health, which are really different than environmental determinants of health, which include water, food, and natural resources, and how they're impacted by environmental change, and how those changes then impact our health and well-being. Next slide. So I've just included the resources here in case anyone's interested. And now I'm going to turn it over to Dr. Abukaya.
Greetings, everyone. I'd like to offer you now an introduction to forest bathing and forest therapy, and invite you to consider forest bathing as a modality for healing and mental health and overall well-being, and actually many of the ailments that Sue Ellen described, but also as an intervention, as a doorway to healing our relationship and partnership with the rest of the natural world. So first, forest bathing, forest therapy is an adaptation of forest bathing. Forest therapy was developed in the United States and was inspired by a practice called forest bathing that was developed in Japan in the 1980s in response to a then national health crisis. So the Health Ministry of Japan at the time noticed a spike in stress-related illnesses, such as cardiovascular disease, hypertension, also mental health, such as increase in suicide-related deaths. And the Health Ministry of Japan attributed this shift to the fact that at that time, the economy of Japan had moved from an agrarian and rural economy to an urban and technological economy. And so they created thousands of acres of certified trails throughout the country and invited their entire workforce to engage in outdoor experiences, which they called forest bathing. And they began what is now over 40 years of research on the impact of this practice. They noticed a drop in the rates of chronic disease and suicide.
Dr.
Yes.
I'm sorry. Do you have slides?
They're not being shared?
No, I'm sorry.
I'm sorry. Well, I'm glad you told me. Okay, well, it says, let me try this. Am I screen sharing now?
Yes, we see your screen. Thank you.
Well, thank you again for letting me know I thought I had shared it, obviously not entirely. So as I was saying, the forest therapy is based on this practice in Japan, and there started then in the 1980s decades of research on both the mental health and the physiological health benefits of forest bathing. One of them in particular has to do with when we are in the atmosphere of the forest. So Shinrin-yoku, the Japanese title for forest bathing, literally means bathing in the atmosphere of the forest. Trees have essential oils that protect them when they shower, when they themselves are showered by these essential oils. They're showered with an aromatic compound called phytoncides, and these phytoncides help protect the tree against fungi and other invaders. When we inhale phytoncides, we also have our immunity boosted. There was a Japanese study, for example, that showed a rise in the number, a very significant rise in the number of natural killer cells in our immune system after a time spent bathing in the forest. The other major component of the atmosphere are called terpenes, another large class of very prevalent organic compounds in the forest that when we breathe in terpenes, these also have anti-inflammatory, anti-tumor, and also even neuroprotective benefits. So forest therapy is a practice that is a invitation to really slow down and experience our bodies, our senses, and ultimately a series of invitations to experience partnership with the forest. These invitations in a guided forest therapy experience, there's no right or wrong way to do anything. They're truly invitational, meaning people are invited to do whatever feels right to them. And then after the invitations, we're invited back into a sharing circle and share with each other what we are noticing. Usually a forest therapy experience is a few hours, maybe an hour and a half or 2.5, or it can be a whole day, or it can be a several day immersion. But what I'd like to do today is invite us to have a few minutes of forest bathing, just as a taste. So if you can, I would like to invite you to move to your window. Maybe you can step outside. If you can, go ahead, and you might want to grab a jacket. If you want to take your laptop, just take it with you and then we'll come back. Or if you want to call in on your phone and just take the audio with your phone, whatever's easiest for you. And if you can't step outside or don't have a window, even if there's any living being in your environment, if you can bring a plant close to you or a pet, any other living being. So I'm hoping now that you're somewhere where you can have some experience of the living world. If you're sitting in a chair, just feel the support of your body, of your chair. Maybe place your feet on the ground. If you're standing, feel the floor or the ground beneath your feet. I'd like to just invite you to begin, but just notice where you are. Just take a moment and look around. Notice your environment. Gently close your eyes and begin to notice your breath. Just notice your breath. You might notice your breath getting deeper or slower. Now, notice your legs and your feet, and imagine that you have roots that extend down from your legs, down through your feet, down into the earth, deeper and deeper. If you're outside, notice the feeling of the air on your skin. Just notice the feeling of the air, not only on the skin that's exposed, but also on the skin that's inside your clothes. Notice any smells that you can take in. Just take in the smells. You might want to move your head around to different directions. Let's now listen to the sounds around us. Some will be human, perhaps some non-human. Find something nearby that you can touch. Maybe a living being, maybe it's a leaf or a rock or a pine cone or your pet. See if you can touch something that's part of the natural world. Feel it in your palm. Just feel the textures of something. And when you're ready, you can let that go. You might want to smell it, or if it's something natural, smell your hands after. I want to now just invite you to tune in to your heart, to the space in your heart. Just notice how your heart is responding to your place. If your eyes are closed, I invite you now to gently open your eyes. And as you look around you, just notice what's moving in front of you. Just notice motion. As we begin to make our way back to the Zoom talk, I wonder if you are noticing any effects on your body or on your mind of tuning into your senses in this way. So let's gradually make our way back to our Zoom talk. And when you are ready, in just 1 or 3 words, I want to invite you to share in the chat, just 1 or 3 words. What are you noticing? I see people coming into the chat. Thank you. I have been guiding healthcare providers in forest bathing now for about 1.5 years. And on this slide and the next are just a few anonymous quotes from observations that people made while they were out after some of the other additional invitations during the forest bathing. And I invite you to consider that people are noticing not only the land and their bodies, but also our relationship and partnership with the land. So as we said, there is just enormous amounts of research now on the benefits of nature in general and some specific to forest bathing. And the health benefits are both in the physical realm and the mental health realm, as well as in the realm of cognitive performance, attention, and memory. And many of the things that Sue Ellen was describing as concerns about health are also addressed by forest bathing. There's many studies showing that immersion experiences ranging from 20 minutes to hours to days improves mood, reduces stress, actually even helps lower glucose levels among diabetics. There's a study of 10 minutes outdoors of middle-aged men with hypertension showing reduced blood pressure as well as improved heart rate variability. There's a series of studies that are population-based that look at the overall amount of tree canopy near a population and are finding correlations between the access to nearby tree canopy on population health, such as improved pulmonary health, decreased bronchitis and pneumonia for people who live in areas near more tree canopy. Even among neonates, there are studies showing the populations near more tree canopy have fewer small for gestational age or preterm births. Sleep is improved. This lovely study, a large surveillance study, showed that access to nearby natural surroundings is protective against insufficient sleep. Turning to mental health, there are, again, this is just a sampling of many studies. This study by Berman studied adults who had a diagnosis of major depressive disorder. And in a crossover study, some of the adults were assigned to either walk in a residential urban environment or in a green environment. And the adults who had time in the green environment showed improvement in the outcomes studied both in the mood states and in the cognitive task memory performance. The cortisol levels that also Sue Ellen described have been studied in numerous ways in nature research, and many studies have shown a drop in salivary cortisol after, for example, this study of 8 weeks, where 36 city dwellers could simply choose a nature experience of their own choosing for 20 to 30 minutes 3 times a week. And those in the study group showed a decrease in salivary cortisol and salivary alpha amylase, which is also associated with stress. Rumination, there's a whole series of literature on the neuroscience of rumination. This term comes from cows chewing their cud over and over, and when people ruminate, telling themselves the same stories over and over, there are studies showing how time in nature can interrupt, and there's a neuroscience behind this, in the insular cortex, how nature can interrupt rumination and bring us back into our bodies. Kathy Wolf is a major researcher in this area. She lives in Washington State, showing, and one of her studies showed, again, and looking at the overall tree cover near nursing home residents, the more tree cover nearby, the lower the depressive symptoms among nursing home residents. Of course, there are many controls in these studies that I'm not going into all the detail. This was a lovely study comparing a walk in a bamboo forest for 15 minutes compared with a walk in a city area. And the outcomes, there were blood pressure and many other physical aspects studied, but also anxiety was studied. And there was a significant decrease in the anxiety scores for people who walked in the bamboo forest, as well as an improvement in the participants' relaxation and attention scores. I love this study because it was stress in the context of daily life. And in this particular study, rather than offering people a structured forest therapy or guided experience, they were asked to simply go outside 3 times a week. And they could choose anything they wanted. It may be out on their back deck or sitting by a window or out in a forest or anything in between, at least 3 times a week. And those in the intervention all showed a significant drop, again, in salivary cortisol, as well as salivary amylase. There's a really burgeoning area of research, and not just research, but practice, using forest therapy to heal people from trauma. A study, for example, showing the evidence that nature and forest therapy improves recovery for military veterans and at-risk youth. There's a huge system study of, a system review of the impact of forest therapy on depression, with over 28 studies summarized with the conclusion that forest therapy is an effective intervention. I won't have time to detail today, but I just want to allow you to be aware that there's a lot of studies of what's called the restorative benefits of nature, restoring our sense of well-being, treating children with attention deficits, restoring our cognitive performance, and really kind of restoring our sense of having resources, psychological and emotional resources. I want to close so that we have time to have our Q&A, but I want to close with the last piece about the other aspect of forest therapy, which is also inviting us into partnership with the land and into understanding and experiencing the lessons that the forest has to offer us. This picture is buffalo, as I'm sure you know. These are buffalo in the Yellowstone. And buffalo graze on grass. And of course, as they do, they deplete the grass that they're grazing. but they also have in their saliva, buffalo secrete an enzyme that, while they're grazing on the grass, promotes the growth of the grass. And this is one of many, many examples of reciprocity in nature, where there is give and take between not only the buffalo body, but our bodies and our environment. There are many examples of reciprocity and lessons to learn. So in closing, I want to just invite you to consider forest therapy not only as a means to our own individual well-being, but also a way to restore our experience of interdependent beings with the rest of the natural world, and also our belonging in it. And in this way, it's my hope that forest therapy can help to create the conditions in which we heal not only ourselves, but also our world. So I'd like to now turn to the Q&A or the chats and invite you to participate with us.
Thank you, Dr. Abukaya and Dr. Brakey. This was wonderful. And I wonder, Dr. Pinsky, if you would like to comment from your expertise in clinical practice on the presentation. And there have been some questions in the chat that have been responded to. Thank you.
I don't know if that was a question for me to kick things off. I would just say that from the perspective of a child clinician and someone who is increasingly seeing eco-anxiety or solastalgia, as Sue gave us kind of the overview on, it does seem to me that all of these principles and approaches, and also the impacts that we've been talking about, really are heightened in children who are, I think, what we know actually are particularly vulnerable to these things. I would love to hear from Dr. Abukaya if there is a literature or sort of who is working with children or youth specifically in this space, and whether that looks any different, or whether there's sort of any interesting tidbits in thinking about that.
There is definitely a literature of people working with children in this space. I can perhaps try to compile something and send it out, but that there is definitely a literature on anxiety in children and on attention deficit disorder in children. So people are using, and I'm sure you're familiar with this, what's it called, ecotherapy or something, like doing therapy outside, combining the out of doors with the psychotherapy or with the programs. There are also programs for children. So, and some of my colleagues in the forest therapy world have begun programs for children, and I would be very interested in supporting it that any way I could. So I'll share with you, but there's definitely a good and emerging literature there.
I would just also like to actually dig in a little bit further for a question for all three of you, actually, in terms of the mental health impacts that we see in the youth and the anxiety, the PTSD, and besides going outdoors for therapy, is there any specific type of intervention and treatment for these mental health effects secondary to climate change? Is a treatment different from just treating general anxiety, depression?
Well, I'll tackle that from my perspective. I'm sure the others will have their own perspective, but because when forest therapy is used as an intervention, because it does actually restore our relationship with the land, and in the small taste of 5 minutes today, we didn't get to the other more deeper imaginative and psychological invitations, but it does restore our partnership and our relationship to the land. And in so doing, I think offers an avenue for treating solastalgia and eco-anxiety directly. Because when we come into partnership with the land, if we're grieving and anxious and saying, oh my God, what have we done to the planet? It's tempting to kind of be paralyzed almost by it, right? When we come into partnership, and I'll just tell you my own personal experience, which is not a research study, but I've seen it in others. I, for example, have sat with the trees in conversation and asked for help in understanding how I can help heal the climate and the environment. And when we come into these relationships, we can also engage in a partnership understanding with the land in ways that I think helps us all move forward into solutions and into feeling empowered and agent and feeling like we belong here in a way that helps, I think, get past some of the anxiety and paralysis that it can create.
I would say one of the things that I've been reading a lot about, especially with younger people, is getting them to be activists in the climate change space has been helpful for them, and creating these strong social connections. So I mean, from a kind of the context around which they might be treated for anxiety or depression, etc. There's really an emphasis on creating social connection. And when I listen to you speak, Dr. Abukaya, it's a lot about what you're saying really mirrors what Indigenous values are.
Yeah.
We're almost trying to bring those, to other people outside of those communities.
Yes.
And when you talked about the sharing circles, the study that I mentioned, this qualitative study, they actually use sharing circles as their method of data collection.
Mm.
And what they found was that the sharing circles themselves were therapeutic. And that was a surprise to them. They weren't anticipating that would be the case. So, and the only other thing I just wanted to make note of, as you were speaking, I thought about the height of the pandemic, and everybody, because we couldn't go to the mall and we couldn't go to the movies, everybody was spending time in nature. And, I'm a member of the trustees of the reservation and couldn't get in. You had to actually make an appointment to go be in nature because so many people were doing that. So I think it speaks to almost, for some, like an intuitive response to that pandemic was to get out and feel the sunshine and the fresh air. So really interesting.
I know we only have a couple minutes left. I was just going to chime in Winnie's question about sort of treatment for kids who are struggling. And what I think I would say is that this is a field and a topic that's really in development. And there's ongoing debate, not just about how to treat kids who are struggling with this, but also, is this even a diagnosis? We think of treatment as being something we use to fix something that's pathological. And I think many of us would argue that there is nothing pathological about feeling despair or anxiety about climate change. And what model we ultimately arrive at is this more about a problem of imbalance or loss of connection, as our speakers are talking about, and that is what needs to be corrected or treated? Or is this, which I like because it's less of a problem with the young person or with the child. What I would say is that traditional modalities to treat anxiety, things like cognitive behavioral therapy that are about, not having catastrophic thinking and restructuring the way you're approaching a problem, that's in many ways not an effective intervention for a real threat for climate. Absolutely agree with Sue Ellen that finding a community of peers who want to take action with you can be really therapeutic for kids. But again, what we're calling this, whether it's an illness and whether it needs treatment, as opposed to the grown-ups just getting their act together and doing something about it, I think is an ongoing question.
Thank you. I know we have just a couple minutes. I would love to also hear from the three of you, your thoughts about just the inequities in the environmental space and, bringing that up and how we can advocate for more green space in schools and urban areas.
It's definitely threaded through the climate change crisis. And as I mentioned at the beginning, this idea of, social, racial inequities, the pandemic, climate change, it's all highlighting these inequities, as we all know. I think, one of the things we're trying to do it through the center is to become, we're trying to grow our advocacy arm and look at ways we can get involved. We are currently working on a project, which hopefully will take root, to advocate with community members around the Black Momnibus Act, which was introduced by Cory Booker and Lauren Underwood. And it's a series of 12 bills, and one of them is actually aimed at pregnant women and pregnant people and kids under 3, I think it is, and the impact that climate has on the health of those groups. And so I think that's where we're trying to move next, is to become more active in advocating.
Thank you, everyone. I know this is, we could keep talking about this, but it is 1 o'clock, and I so appreciate all of what you have shared with us today, and for the audience for joining and the good questions. I just would take this opportunity to say that next month we will continue this theme. The next month is the importance of trees for our climate and health, but a professor at BU in the environmental studies, and also Roseanne Bongiovanni, who is part of Chelsea Green Roots, talking about environmental justice and post-pandemic Chelsea. So I hope to see you there. Thank you, everybody.